Braden Stauffenberg, and I'm interviewing Dr. Katula from Rush Copley. I'm doing a paper about should kids play tackle football and researching about concussions. My first question is, what is a concussion?
A concussion is any brain injury. So usually we think of a concussion as any blow to the head that causes a brain injury.
Okay. What are the dangers of a concussion?
There's lots of dangers. Concussions can be mild, as little as a headache or even no symptoms, to very serious conditions such as bad neurologic problems such as seizures or even death.
What are the effects of a concussion if untreated?
Concussions can have long-term deficits for our neurologic systems. And a deficit would mean that something that doesn't work right anymore. For example, someone could lose their vision, someone could lose their memory, someone could lose their ability to speak or use words correctly, so they could lose a fundamental aspect of their central nervous system.
What are the effects from more than one concussion?
With each concussion, especially if they happen close together, they're cumulative, meaning they add on, and they can make things more severe. So even if there's even one concussion, the second concussion can add to that and make things even greater. So it's different than if you get a bruise and then just get another bruise. It could mean that your deficits and your ability to heal will be prolonged.
Okay. In regards to tackle football, is there a specific age group, like youth tackle, high school, college, or pro, where concussions are more common injury?
The bigger and faster people are, the more severe concussions can be because the head injuries are more severe. In the current thinking, the idea isn't just about having one concussion. The fear is that people who play football for a longer period of time have multiple concussions. And going back to your last question, is it more dangerous when you have more than one? Well, if you have multiple over a long period of time, the thought process right now is that causes longer term problems. So if you're asking, is there one group who's at the highest risk? Well, individually, the people who are bigger, stronger, faster probably are at the worst risk. But overall, the thought is people who play for a longer period of time may be at the highest risk.
Do you have any stats on how many concussions were diagnosed to kids in Yorkville and age group specific?
Well, it would depend on the sport, and I do not have the accurate exact stats for example, I don't have them for YYTF, not for this last year. For previous years, I could make estimations, but it would just be a guess.
Okay. Can concussions be prevented by better equipment or better skills?
Absolutely. You should have good equipment. There's no question about that. And the better the equipment, the better we know you can protect your head. But also, the appropriate training, practice, and technique that's used can avoid some of the blunt head injuries that lead to concussions.
Due to risks of brain injury, is there an age where kids should not play football because the brain is still developing?
I'm not sure we have that answer yet scientifically. My answer is no, but I think that science is still being developed. Right now, there's groups of youth football, for example, USA Football, which is a big group in the United States, and Pop Warner are currently collecting data on what's the best way to handle concussions, what's the best way to prevent concussions, and they're putting into effect different plans to try to prevent concussions, and they're going to see if those plans work. So they are looking at that for the younger kids. I'm not sure we have all the information yet.
What are the alternatives for kids that love to play the game of football, but parents may think it's unsafe?
Well, there's a lot of different things. I am a big proponent of kids participating in sports. With any sport, there's always a risk of injury, no matter what the sport is. There are sports that are more at risk for head injuries. Any contact sport or combat sport has that problem. So if the parents have a fear of something like football, we encourage other fall sports. And the fall sports can be anything from cross-country running to soccer to any number of other sports. But I say that with a grain of salt because even in things like soccer, there is a risk of concussion.
How has the game of football changed due to concussions being made one of the main topics of safety?
We've changed how kids practice and how we run practices. We try to limit the number of contact plays that are done during practice. We also spend a great deal of time trying to teach kids how to properly tackle and to receive a blow at practice. Even as close as 10 years ago, we did a lot more hitting in practice than we used to. And I'm saying that as a coach, not as a physician. But we did a lot more hitting than we do now.
Okay, thank you.
Good?
Mm-hmm.